Thank you so much, Your Excellency. An absolute honour to meet you, and thank you for your time. I think when we look at case studies, what's important is that there are real outcomes to meetings like this. And what has been a pleasure is attending an event with exemplars in the field, people who are 100% getting it right. And I've loved learning about different projects. I've loved meeting new people and hearing about incredible things that are happening. With Kids Operating Room and Global Hospital, which is a company we own, we are trying to go to those who maybe aren't always getting it right. And sadly, that is the majority, probably, of the people investing in global health space. And that is because they don't always go end to end the way you're talking about today. So they will see their intervention and they'll go ahead and do their thing, but they won't consider, is there a local supply chain for that product? They won't consider, is there a local engineer capable of caring for that investment? And what will happen at the end of life of this thing that we have given this hospital? And is it going to end up rusting out the back of the hospital? So, Kids Operating Room is an NGO that creates surgical facilities, and we've become pretty good at it. We work in 27 countries around the world. And I think if you want an operating room built anywhere in the world, then I think our model works. I think it's effective. It uses local supply chains. It builds into the local system, and it does it effectively. Global Hospital is a company we own, and it is there to support any healthcare intervention or project. So if, and we were talking about Zambia earlier, we were talking about saying, well, is there capacity in Zambia to scale up access to care and to tap into the resources of the social security model? Then yes, we believe that there is, and that actually capacity can be created. And that it can be done in a way that supports the training of Zambians to look after that equipment, the training of clinicians to use that infrastructure, and it puts in place local supply chains. The goal ultimately should be to not be needed. And that is what I think we should all be working towards, a day when these countries say to us, thanks very much, we've got it now. And I think the way to do that, as you all, I suspect, will agree, because you're all doing it, is to strengthen the system, is to support from the things we are asked to support on, and then to step back when the time is right. I think that that's possible in every single country. I think it's definitely possible if we're going to focus on Zambia. And I know Professor Macassa's got some thoughts, can maybe pick that up and run with it. But I think that investing into healthcare infrastructure can be done in a highly effective way for any healthcare situation. And in women's health, it can absolutely be done in a way that every aspect of women's health can have the infrastructure and the local people that they require. We know the solutions to these problems. We just need to make sure we have the funding available to deliver them.
David, could you comment about the solar, just expand a little bit about the solar power aspect too?
Yes, so we hear constantly that power supply outages are a problem, and so we ran a trial in 4 different countries, in Nigeria, the Democratic Republic of the Congo, Tanzania, and in Kenya. And we monitored, first of all, what actually happened in the hospitals. And we found that in papers, in research that we're just writing up for publication, but what we found was that 5 out of every 6 days there would be a power cut in one of these hospitals in the operating rooms. When there was a power cut, the average time out was 99 minutes. And that on days when there was a power cut, the average time lost was 4 hours. So that means that in hospitals that are providing maternal health services, the ORs were going out for an average of 4 hours for 5 out of every 6 days. So if you want to immediately increase the capacity of care, then the first thing to do is get your current systems working. So we designed a fairly straightforward system, smart battery, solar panels, which means that we can You can deliver an operation when the sun's shining purely using solar power. You can, it will maintain the battery at 100% so that if it gets dark, then the battery will provide that power, and only rely on the grid as the sort of third and final requirement or source. And so in order for that to happen, you'd have to be working deep into the night before the grid was needed. This reduces the cost of providing care for the hospital because there's no electricity costs. It increases the patient safety because the power remains stable. And it reduces the carbon footprint of the hospital. By a huge amount? No, but by about 1.5 tons a year per operating room. And that's something. And sorry, Professor McCassa, you're totally right. What this system does is it protects all of the equipment. And so what actually was happening was when these power outages were happening, the surge would then damage the equipment. And so you then have redundant equipment in the operating room. And this system, you'd think I would know because I was involved in designing it, has a force strength, and that is that it protects all of the equipment in the operating room. So again, that can allow safe surgery to happen in any hospital in Africa. So we know the solutions. We can provide surgery, we can provide increased capacity in hospitals without a huge investment. And we can make sure that women, particularly women going through childbirth, where there's still heading towards 800 women a day, will die in that situation, which means we can put a measurable number on it since this meeting started. We could immediately tackle that by simply increasing capacity from the existing stock of hospitals.